Welcome to today's video about amlodipine versus metoprolol, which is safer for seniors. If you're over 60 and taking blood pressure medication, what I'm about to share could change how you feel every single day. You might be dealing with swollen ankles, exhausting fatigue, or dizziness when you stand up. And you've probably been told that's just part of getting older. But here's the truth. It might not be your age. It could be your blood pressure medication. I'm talking about two of the most prescribed drugs for seniors, amlodipine and metoprolol. And while both lower your blood pressure, they work in completely different ways in your body. One might leave you energized and active. The other might drain your energy and increase your fall risk. Stay with me for the next few minutes because I'm going to show you exactly how these medications affect your body, what the latest research says, and the specific questions you need to ask your doctor at your next visit.
Next, understanding how each medication works. Let me explain this in the simplest way possible, no medical jargon. How amlodipine works. Think of your blood vessels like a garden hose. When calcium enters your muscle cells in your blood vessel walls, those muscles squeeze tight, just like when you pinch a garden hose. That squeezing raises your blood pressure. Amlodipine blocks that calcium from getting in. Your blood vessels relax and widen. Blood flows more easily. Your blood pressure drops naturally. It's called a calcium channel blocker, and you take it once a day, usually 5 milligrams or 10 milligrams. It's been prescribed since the 1990s, so we have over 30 years of research on how it works in older adults. How metoprolol works is completely different. It's a beta blocker. Your heart has special receptors that respond to adrenaline, especially when you're stressed. These beta receptors tell your heart to beat faster and harder. Metoprolol blocks those receptors. It's like putting a gentle brake on your heart. Your heart beats slower and with less force. That reduces your blood pressure and takes stress off your heart muscle. Metoprolol comes in two forms: immediate release, taken 2 to 3 times daily, or extended release, once daily. Why this difference matters. Here's the critical part. Because these drugs work so differently, they cause completely different side effects in your body. And for seniors, those side effects can be the difference between staying active and independent versus feeling exhausted and at risk of falling. Let me show you exactly what the research reveals about each medication in people over 60.
Next, the research on safety for seniors. Let's talk about what actually happens when seniors take these medications. I'm going to share findings from major research studies, not opinions, but facts. Amlodipine research in seniors. The ALLHAT trial followed over 33,000 patients and found that amlodipine was highly effective at preventing strokes and heart attacks in older adults. This was published in the Journal of the American Medical Association in 2002. The study specifically showed that amlodipine performed as well as diuretics for preventing the primary outcome of heart disease. According to research in the American Journal of Hypertension, about 2% of people on low-dose amlodipine, 5 milligrams, experience ankle swelling. But at higher doses, 10 milligrams, that jumps to 10 to 25% of patients, particularly women and those over 65. Here's something important. A study in the Journal of Pharmacy Technology found that among seniors taking amlodipine, 15.6% developed noticeable ankle swelling. For some people, this is mild. For others, their shoes don't fit by evening. The research also showed that this side effect increases with longer duration of use, often plateauing about 6 months. But amlodipine doesn't significantly slow your heart rate. If you're active, if you walk, garden, or exercise, your heart can still respond normally to physical activity. This is a crucial advantage for seniors who want to maintain their independence and physical fitness. Metoprolol research in seniors. The MERIT-HF trial published in The Lancet showed that metoprolol reduced death rates by 37% in seniors over 65 with heart failure. Sudden death was reduced by 43% and deaths from worsening heart failure dropped by 61%. If you've had a heart attack, metoprolol can be genuinely life-saving. But here's what many doctors don't emphasize enough. Beta blockers come with trade-offs for seniors. A study in JAMA Internal Medicine involving nursing home residents found that beta blockers reduced 90-day mortality by 26% after a heart attack, but they increased functional decline by 14%. For seniors with moderate to severe dementia, beta blockers increased functional decline by 32 to 34%. The most common complaint? Fatigue. Beta blockers slow your heart, which means less blood pumping through your body. Some seniors describe feeling foggy or half asleep during the day. This isn't just inconvenient, it can significantly impact your quality of life and your ability to enjoy daily activities. Research published in the Journal of Clinical Hypertension shows that dizziness and low blood pressure when standing up are significantly more common with beta blockers than calcium channel blockers in people over 65. This directly increases fall risk, one of the most dangerous threats to senior independence.
Next, side effects you need to know about. Let me be direct about what you might experience with each medication. Amlodipine side effects. Ankle swelling is the #1 complaint. According to research from the NHS and multiple clinical studies, this happens because amlodipine relaxes blood vessels in your legs, allowing fluid to leak into surrounding tissue. It's not water retention, it's fluid redistribution. That's why diuretics, or water pills, don't fix it. Facial flushing happens to about 4% of people. Your blood vessels are more dilated, so some people feel warmth or redness in their face, especially in the first few weeks. Headaches can occur as your body adjusts to the medication, though these usually improve within 2 to 3 weeks. The good news? Amlodipine doesn't affect your blood sugar if you're diabetic. It doesn't worsen breathing if you have asthma or COPD, and it doesn't cause the extreme fatigue that beta blockers do. Metoprolol side effects. Fatigue is the most reported side effect. Your heart is literally working less hard, pumping less blood. For many seniors, this feels like constant tiredness, especially in the afternoon. Dizziness when standing up is called orthostatic hypotension. When you stand, your blood pressure drops. For seniors, this is dangerous. It causes falls, which can lead to broken hips, loss of independence, and serious complications. Research published in Curious Journal documented an 84-year-old man who developed confusion, nightmares, sleep disturbances, and gait problems from metoprolol. Beta blockers can cross into your brain and cause these neurological effects, particularly in older adults. Masked symptoms of low blood sugar. If you're diabetic, metoprolol can hide the warning signs of hypoglycemia, making it harder to recognize when your blood sugar drops too low. And here's critical information. You cannot stop metoprolol suddenly. Abrupt discontinuation can cause rebound hypertension. Your blood pressure can spike dangerously within days. You must taper off slowly under medical supervision.
Next, when each medication is the better choice. There's no one-size-fits-all answer. The safest medication for you depends on your specific health situation. Let me break this down clearly. Amlodipine may be better if you want to stay physically active. Amlodipine doesn't reduce exercise tolerance. Research from the American College of Cardiology confirms that calcium channel blockers allow normal heart rate response during physical activity. This means you can still walk, exercise, and move without feeling your medication is holding you back. Have breathing problems. If you have asthma, COPD, or any lung condition, amlodipine is typically safer. Metoprolol can sometimes worsen breathing problems because beta blockers can affect receptors in your lungs. Are diabetic. Amlodipine doesn't affect blood sugar control and doesn't mask the symptoms of low blood sugar. This is crucial because recognizing low blood sugar symptoms can literally save your life if you're diabetic. Have poor circulation in your legs, peripheral artery disease. Amlodipine is generally better tolerated because metoprolol can sometimes reduce circulation further, potentially worsening symptoms like leg pain when walking. Process medications slowly.
Amlodipine is metabolized by your liver, so if you have reduced kidney function, which affects nearly 40% of adults over 65 according to research, amlodipine puts less stress on your kidneys compared to medications that rely heavily on kidney elimination. Metoprolol may be better if you have had a heart attack. The evidence is clear. Metoprolol significantly reduces your risk of another heart attack. Research in Stat Pearls shows that metoprolol reduced mortality and reinfarction when used after myocardial infarction. This benefit is so well established that it's considered a standard of care. Have heart failure. Metoprolol helps your heart muscle recover and work more efficiently over time. The MERIT-HF trial showed a 61% reduction in deaths from worsening heart failure, a truly remarkable benefit. Have irregular heartbeats like atrial fibrillation. Metoprolol controls heart rate much more effectively than amlodipine, helping prevent complications from rapid heart rhythms. The key is this: both medications significantly reduce your risk of stroke and heart attack when used appropriately. According to research in multiple cardiology journals, we're talking about a 25 to 35% reduction in cardiovascular events. That's substantial protection for your health and longevity.
Next, practical steps and what to ask your doctor. Here's exactly what you need to do next. If you're currently taking one of these medications, monitor yourself honestly. Are you experiencing side effects that impact your quality of life? Write them down. Track when they happen. If you have ankle swelling from amlodipine, don't suffer in silence. There are solutions. Reducing your dose, switching to a different calcium channel blocker, or adding an ACE inhibitor can dramatically reduce swelling, according to research in the Journal of Human Hypertension. If you have fatigue or dizziness from metoprolol, talk to your doctor about timing. Some seniors do better taking it at night to minimize daytime fatigue. Questions to ask your doctor. Be specific. Here are the exact questions. Based on my complete medical history, including my kidney function, other medications, and lifestyle, which blood pressure medication do you think is safest for me, and why? What side effects should I specifically watch for, and which ones mean I should call you immediately? Should I take this medication in the morning or at night? Does timing matter for my situation? If I experience bothersome side effects, what are our options? Can we adjust the dose or try something different? How will we monitor my kidney function and other organ systems while I'm on this medication long term? Home monitoring. Get a home blood pressure monitor. They cost about $30 and provide invaluable information. Check your blood pressure at different times of day and keep a simple log. This gives your doctor much better information than a single reading in the clinic. According to research from Johns Hopkins, reducing sodium intake to under 1,500 milligrams daily can lower blood pressure by 8 to 14 points, sometimes enough to reduce medication doses.
So, here's the bottom line after reviewing all this research. The safest blood pressure medication for you isn't determined by what your neighbor takes or what's most popular. It's determined by your unique health situation, your other medical conditions, and your quality of life goals. For seniors with diabetes, breathing problems, or who want to maintain an active lifestyle, amlodipine is often the better starting choice. Research published in multiple peer-reviewed journals supports this. For seniors who've had a heart attack, have heart failure, or struggle with irregular heartbeats, metoprolol typically provides superior protection, despite potential fatigue side effects. MERIT-HF and other landmark trials prove this conclusively. But here's what matters most. Your blood pressure medication should help you feel good enough to live the life you want, to play with grandchildren, to travel, to maintain your independence. It shouldn't just lower numbers on a monitor. It should support your health without stealing your energy or increasing your fall risk. According to CDC data, nearly 60% of adults over 65 have high blood pressure. You're not alone in this, and you deserve a treatment plan that's tailored to your body, not a one-size-fits-all prescription. If this information helped you understand your options better, type yes in the comments.
And if you think this could help someone you love, maybe a parent or spouse who's struggling with their blood pressure medication, share this video with them. Before you start or change any medication, always consult with your healthcare provider who knows your complete medical history. Take care of your heart, and I'll see you in the next video.